perform hand hygiene, and then I go ahead, provide privacy. I do my 60-second assessment, ABCs, and assessing any clutter. And then, hi, my name is Sylvia. I'm going to be your student nurse. Can I go ahead and get your name and date of birth?
I'm Yi Zhou, 1992, February 20.
Okay. Do you have any allergies, Yizo?
No.
No? Okay. All right, so today I'm going to go ahead and be moving through all your pulse points. This is just to ensure that blood flow is moving adequately throughout the body. Is that okay?
Mm-hmm.
Okay. So it is going to require me to touch you. I'll try to be as gentle as possible to not cause you any pain, all right?
Okay.
Okay, so first I'm going to start off with the temporal. Okay, perfect. Okay, then I'm going to move into the carotid. For this one, I'm going to make sure to check unilaterally. You don't want to check both because you can risk occluding it, okay? Okay, now I'm going to go ahead and do this side. Okay, perfect. Now I'm going to go ahead and move on to the auxiliary. This one is going to be right underneath the armpit. I'm going to go ahead, I would check both bilaterally, but it's kind of hard because of the video, so I'm going to do one at a time. Okay, this might require me to press a little hard, okay? Okay, perfect. I'm going to go ahead and do this side. Much easier. Okay. Now I'm going to move on to your brachial pulse. This one is also the one that we use for blood pressure. Perfect. That one was easy. And because I already have the arm out, I'm going to move into the radial. And for these ones, I could check at the same time bilaterally. Perfect. That one's easy. Perfect. That one's easy. And then I would move into my apical pulse. This one I would take for 1 full minute if I'm giving like a hypertension medication. I would use the back of my hand, or I would ask the patient to lift with their own hand. Do you mind if I use the back of my hand?
No.
Okay. I would go ahead, lift, and I would place it right underneath the breast, and I would take that for 1 minute. Okay, so now I'm gonna go ahead and move on to my femoral. It is in the groin area, so you wanna ask them if they can spread their legs a little bit, and then this one you might have to press a little deeply, okay? So is it okay if I touch you right here?
Mm-hmm.
Okay. And this one you also wanna check one at a time, okay? That was actually pretty easy. It helps if the patients don't have a lot of adipose tissue. Okay, now I'm gonna move into the popliteal. This one's right underneath the knee. This one I kind of always struggle with. Okay, now I'm gonna go ahead this one. Perfect. All right, now I'm gonna go ahead and move into the posterior tibialis. This one is gonna be behind the ankle. And then when you are assessing these points, you wanna make sure that you're not using your thumb because your thumb has a pulse point. Perfect, that one was easy. I'm gonna go ahead and do this one. Okay, perfect. Okay, if you can, go ahead and remove your shoes. And I'm gonna check the dorsalis pedal. It should be between the toes, follow it down. Okay. Go ahead, do this one. Okay, perfect. All right. This is just a good way to check for making sure that the extremities are receiving blood flow and that there's proper circulation. Okay, I did all 10 checkpoints. Is there anything you need from me right now?
No, I'm fine, thank you.
Okay, I will be back in 20 minutes to reassess. Thank you.